Developing right now, state police say a woman used multiple identities to pose as a nurse. Channel 11's Jatera McGee has been following this story since it first broke at 3 o'clock and joins us now in the studio with the details. Jatera?
Well, Gordon, we still have a lot of questions about how this happened. The alleged fake nurse just appeared in court this afternoon, and she's facing several charges, including identity theft, corrupt organizations, and endangering welfare of care-dependent persons.
Shannon Womack is not a licensed professional in the state of Pennsylvania or any state that BCI was able to investigate.
Bombshell allegations announced Monday by Pennsylvania State Police. They say a woman named Shannon Nicole Womack has been posing as a nurse and working with patients for the last 5 years.
She was going through proper host agency channels and then created her own as like her own fake secretary, answering the phone call, giving it to herself.
Troopers say Womack worked as an LPN, RN, and RN supervisor at facilities across Pennsylvania. They say she used the identities of real nurses to get jobs, using fake references to clear checks, and that her criminal activity spanned from Georgia to Connecticut.
Around 20 different aliases were attached to Nicole, along with 7 social security numbers.
It all started to unravel when she was pulled over in Pittsburgh in April. State police say they found medical records and various prescriptions that belonged to nursing home residents.
This is a vile act, or acts, I should say, not only taking advantage of older citizens in this Commonwealth, but them not receiving the care that they need, nor the medication that they need because of someone that puts themselves in this position to defraud them.
The affidavit says Womack is listed on Georgia's website for nursing imposter alerts. We found her, but investigators tell us she no longer looks like this. Troopers say Womack worked for these facilities under various aliases in the last year. They're in Allegheny, Beaver, Washington, and Westmoreland counties, and the investigation isn't over.
During that COVID time, they got hit hard and they needed help. So it wasn't uncommon for these different residence locations, agencies to reach out to host agencies and say, we need some extra shifts filled. That started in 2020, and it was such an easy transition. She just kept going after that.
And I just reached out to the Department of Health, and within the last 5 minutes or so, they got back to us with a statement. It reads, the department is aware of the situation and is working in conjunction with other state agencies to determine next steps. Now, I've been reading through these court documents the last couple of hours, and investigators say that Womack worked at most of these facilities for between 1 and 10 shifts. She was placed on a do not retain list for misconduct at all 9 of these places. And in just one example here, troopers say she was in charge of a medical card. Well, 5 residents, they say, went without their medications, and over 120 oxycodone pills went missing. Jatera McGee, Channel 11 News.